Hey everyone, welcome back to our Demystifying Medicine channel. Today, we're going to be diving into a rising healthcare concern, hospital overcrowding. Before we discuss the problem, I would like to highlight what a regular hospital visit looks like. Hospitals tend to be associated with illnesses, and for that reason, the concept of going to the hospital can be anxiety-inducing for many. I want to break down the various components involved in a hospital visit to shift people's mindset and decrease the fear towards hospitals. There are 5 main components of a typical hospital visit that we will be discussing today. The first is checking in. We're going to follow that up by discussing medical examinations. The staff then has to run tests and procedures, followed by their treatment plan. Lastly, you will be discharged when ready. So, what does checking in mean? Every patient that arrives at the hospital is required to check in. Usually, this involves going to the front desk or registration and providing your personal information and insurance information. In Canada, we provide our health cards. This is an important step as it provides any background information and allows the hospital to organize your chart. After checking in, doctors will conduct their medical examination, but what exactly is that? For medical examination, the patient is taken to an examination room where a healthcare provider such as a doctor, a nurse, or physician's assistant will assess them. Healthcare providers' examinations are done through tests and procedures. The tests and procedures you encounter will vary depending on the reasoning for your visit. Hospital staff will guide you through the necessary procedures and answer any questions. At this point, you shouldn't hesitate to ask to make anything clear. Following the tests and procedures, the healthcare providers will come up with a treatment plan. Healthcare providers will prescribe interventions such as medication, therapy, or let you know that you may have to stay overnight. Hospital staff should guide you through your specific medications so you know when to take them and how often to take them. Once again, it's important that you ask questions if you're unaware of what you should be doing. Following your treatment plan, you will be shortly discharged. But what exactly does that mean? Once you are stable and there are no other health concerns, healthcare providers will give instructions on follow-ups, taking medications, and answer any other questions you have. After this, you are free to leave the hospital if you have no other concerns. Fortunately, there are times where the hospital is overcrowded. I'd like you all to imagine this scenario. You fractured your arm and you have to go to the hospital. You're in extreme pain as you wait in the emergency room. Unfortunately, the wait times are extremely long and you're starting to get upset. You notice that everyone in the emergency room is equally frustrated. What you guys are imagining is the reality of current hospital states. This phenomenon is known as hospital overcrowding. Hospital overcrowding refers to a situation where there are demands for healthcare services that exceed the capability of a hospital to provide timely and appropriate care to patients. Overcrowding occurs when there are more patients that require hospitalization than readily available hospital beds. Overcrowding leads to extremely long wait times, such as in the scenario we just imagined. It also results in delays in treatment and compromised patient outcomes. Overcrowding can increase risk of infection and enables the spread of disease throughout the hospital staff and patients. It is a serious public healthcare concern and a prevalent problem that requires a multifaceted solution. To better understand the significance of hospital overcrowding, we're going to hear from Dr. Mobeen Mubasher.
Hey everyone, my name is Dr. Mobeen Mubasher. I am currently a resident physician in the Rural Family Medicine program. I have been working in rural hospitals for the past 2 to 3 years, and I've been learning a lot about the struggles of both patients, hospital staff, as well as administrators. My job in the community involves multiple roles. This includes admitting patients to hospital and managing their acute conditions until they are stable to be discharged back to the community where they receive follow-up. Additionally, I act as a family physician where I provide primary care in the clinical setting. Over my time working in multiple hospitals throughout rural Ontario, I have noticed that there are certain periods, whether that be seasons or functions and events, that lead to rises in patient volumes. This can be during flu season, or sports seasons such as skiing where there's multiple fractures, or holiday season when individuals are in cottage country, for instance, and there are multiple injuries during recreational activities. Regardless of the cause, this is a common occurrence where either due to lack of staff, due to lack of hospital beds or rooms, or due to excess of patients, we can experience overcrowding in the hospitals. As highlighted from this presentation, overcrowding can be problematic for multiple reasons. Firstly, often these are associated with long wait times in the emergency room in particular. A longer wait time implies it will take longer to be triaged and subsequently to be given analgesic medications and starting investigations. In general, other problematic issues arise as well. This include confidentiality, spread of contagious diseases, and appropriate examination. Overcrowding has become a concerning public health issue that is very important to resolve. There's no simple solution, but targeting the problem from multiple different angles can be helpful. From a systemic level, it's important to increase access to timely primary care. This will prevent issues from exacerbating to more critical or even emergent levels. A simple example is patients who are unable to get basic diabetes medication because of having no family doctor, who will present with diabetic ketoacidosis, a potentially life-threatening emergency. From a resource level, it's important to have appropriate funding, rooms, staffing such as nurses and physicians, and administration staff to meet the community needs. For instance, multiple towns and cities in Ontario have their populations that have doubled or even tripled. However, the emergency rooms and hospitals are running with the same number of staff and the same rooms. While I have presented some ideas of how to decrease the burden on hospitals, it's impossible to solve the problem without creating awareness and involving the collaboration of multiple stakeholders. Thank you very much for having me. And remember, don't be scared to go to the hospital or the family doctor despite the limitations we are currently facing.